Yeah, there you are. Hi, Gary. So
Hey,
let's start off with
Michael.
you, Gary. I'm not sure if Adam's joined us, but one of the things that we wanted to do just to use this little time is to really sort of bring up the person once again who's helped start all of this, Timothy Ray Brown. And we've done a virtual memorial for him, and there's been lots of people sharing things about him. But one of the things that we haven't really talked about is the legacy that he's left behind. And I was calling on two people, and there's other people on this call right now who are picking up that baton that he had. They've taken it and they are running with it. And we have one of the two people here. So, Gary, people might not know you because it wasn't as quite as popular. And it seems like it was long ago in terms of cure research when you first came onto the scene. But we knew you. And I remember when you first called me, you said, hello, Michael, you know me as Patient B. One of the two early transplants. And to let everyone know, Gary was a part of an early cure research experiment, which was looking at transplantation to see if that alone was enough to cure someone. In other words, if they didn't need that CCR5 to be deleted. And so Gary went on a treatment interruption without any other sort of intervention, just the bone marrow stem cell transplant that he had for other reasons. And he went for a length of time long enough. I think it was 7 months in total.
Yeah, just over 7.
Right. And so after I think you said about the 3rd month, that's when you first started thinking that perhaps you had been the second person to be cured of HIV.
Yeah, from what I had been told and learned, the traditional trajectory from a statistical model was 3-4 months off of treatment, off of medication, the virus will return. So working with Tim Henrich, when we started hitting the 3-month marker and the 4-month marker, it started becoming more hopeful. And Tim was much more, wait, slow down, hold on. And I was the other side. It's like, well, of course we all want this gone. So I started to embrace that more and more. And then being, I come from a math-based, based brain. Once it started hitting 5th month, 5.5 months, and now I'm, way at the other end of the bell curve. It's like, let's go public, let's go public, let's go public. Because the key I always felt is there are all these stories in the media, but where's the person? Where's the person to put a face to? And at that time, especially for me, was let other people follow the story because the story was not complete. And 2 months later, the story was complete. Virus back, and Tim was able to do enough research to say there were basically 2 cells that survived your transplant. As far as I'm concerned, screw those 2 cells, get them out of here. But unfortunately, they took over. So in Timothy Ray Brown's model, it was go public, let the world know, and let all of our compatriots know, do something, be active, be involved. It's by putting a face to it. So that's, the quick synopsis of my story.
Yes, and I think it's inspiring. I mean, you were not cured from this end result, and yet you still came forward and you were willing to put your face out there as a research participant, saying that your participation, I think the way you put it, you were told that you changed the course of cure research. You answered a major question and redirected things.
And I guess hearing that is humbling. And I remember being out with you in Seattle when you had Tim and I. Mm-hmm. And one of the things I had said, and it's in the video recording, I felt I had let Tim and the world down. I took this on very personally. It's like, wow, I really want to be a success, both for myself and for the rest of the world. And I remember the audience's reaction because Tim and I had this back and forth humorous jab, which we always had. And they were going, what's going on here? The guy's like apologizing for the virus coming back. But it was just, it was an amazing journey. I mean, in an amazing time. There was, I did this through Boston, but my home is New York. And I remember in the 5th to 6 months, was kind of before the virus came back, I'm walking around and I can now recall every person's face I looked at I felt was different than me in a way that was beyond Timothy Ray Brown and myself. No one could understand.
Mm.
So.
And Adam, are you on? I just wanted to make sure. I don't know if we got Adam. Adam is the otherwise known as the London patient, and I was hoping that we would get to hear from him as well. I know there are other people that we've had on this call who are also participants in cure studies who have come out publicly. We were lucky enough in 2019 to have two of them, and I know one of them might be on here. Matt Sharp, are you here?
I'm here.
Hi, Matt. Thank you. I don't know if you wanted to say any words about this legacy of Timothy Brown, and I know actually because you've come out about being a research participant long before Timothy ever came out from the participant angle. But I don't know if you wanted to make any comments about his legacy and your own legacy and Gary's legacy of research participation, coming out stories.
Well, I guess the legacy is survival. For me, I've always been out about my advocacy and my activism. I was in ACT UP for years and was arrested and on, television. And so I've never had any shyness about my HIV and what I was doing and to try to control it and to try to stay alive. And I guess my story goes back to the late 90s when we were worried about the medications. And so we wanted to get into learning about immune-based therapies. I mean, we started with Martin Delaney early on to look at those. And ever since then, I wanted to get into a clinical trial of immune-based therapies. I had a thymus transplant. I was in the thymus transplant study, which didn't go anywhere because combination therapy became available for everybody and was saving lives, which was fantastic. But fast forward, I had the option to be in the Sangamo trial for the first. I was the second patient to have HIV gene editing or gene therapy, and so I did all this merely just it was selfish really for me. I wanted to stay alive, but in the same time, you have to recognize that you're, when you put yourself out like this. Yeah, it is for you, but of course I wasn't doing it selfishly in 100%. I wanted people to know that this was going to be safe and I was going to be well. And thank God I got through it all. And I'm here today alive, over 34 years survival, and sticking to and following this type of research is incredibly important to me because I may not be an option for future cure trials simply because I was in this first trial. But I'm going to follow it anyway, and I'm going to support it in every way I can. And if that's to be on the front page of every of HIV magazine or whatever, I will. So,
and that's awesome.
Sorry.
And I'll share this with everyone. Gary and Matt have both done events here in Seattle with us where they spoke openly about their participation. And one of the things I remember, Matt, about your time is that you had a T-cell boost. You had a T-cell boost from your gene therapy experience that has lasted for years. Did it not? It lasted, I think you said 9 years at the time.
It's still up. It's 10 years time. Fortunately, it was a side effect for the trial, and I talk about that as something that we should, we always focus on the bad things that could happen with gene editing and gene therapy, but we don't talk about these little side effects that can be positive. Like for me, it was, and for everybody in my cohort, we saw a doubling of T cells. And for me, that's stayed now for 10 years. It's starting to decline a little bit, but what we're happy to see is that Jay Lalazari at Quest has been given money to do a 10-year follow-up or continuing follow-up on my cohort. Okay. So he's going back into us mostly to follow for cancers and malignancies and stuff like that. But I mean, who knows? What we will find in following up, and it's important to follow us.
It is,
So,
definitely. Well, and thank you for that. And Adam, I see you've joined us.
Hi. Yes.
Hi.
Thanks for having me, guys.
Hello,
Yeah,
everyone.
good guys. Hello, everybody.
Castillejo, he is the London patient. And I didn't know if you wanted to say a few words about how you've followed along in Timothy Ray Brown's legacy of coming out and putting your name behind the London patient, so to speak, and stepping out from behind that.
As I say, well, yeah, as everybody know, I'm the London patient. First of all, I know would be here without Timothy. It's a blueprint of my survival, what I said before. I started becoming the London patient by 2016, when I actually that was able to have the transplant. What Gary was saying, it's very difficult to go for transplants. And I had my transplant in 2016. At that time, I didn't know really much about Timothy and the story. I think everybody has to kind of fill me in about the story about Timothy. Then I started learning during my journey about his achievement and how many people behind me, like Gary, had failed to achieve Timothy results. Mm-hmm. And when they happened to me, I was kind of, wow, we able to replicate what happened to Timothy. So for me, it was a learning experience. Still learning, Michael, still learning much about his legacy, about his life, about what he means to a lot of people. And I want to be part of that. I want to keep his legacy. And in me, being the London patient, that is kind of huge responsibility now, being the kind of the only one so-called known as we speak. And yeah, it was a very difficult period for me challenging to come out, because I probably, as Timothy and everybody has said, stigma. And for me, it was actually coming out again. Not being HIV, coming out, not being HIV. So it was like a double feeling, and only Timothy understood me. And that time I was so lucky, Michael, to able to speak to him and to relate to him. And finally, I felt like I couldn't talk to anybody. Nobody could understand me, and he was able to do so. For him, it was nice to hear he was not the only one, because I think Timo told me many times he was afraid. Adam, I thought I was going to die and nobody else will follow me. As soon as you came into the picture, I thought, wow, I'm not the only one. And I was very humble when he actually said to me, welcome to the family, brother. And I would never forget that, Michael. And I think, and for me, it's part of it being HIV positive man, ex-HIV positive man. Is part of being, let's talk about it. Let's keep the conversation going. It hasn't stopped, the HIV crusade, to find a cure, feasible and curable for everyone. So, and I felt it was my duty and the responsibility to science, Michael, to come and tell my story, and people can relate to me and understand me. And it's well for Timothy not be on the only one, but it's a scary place to be, just to come out.
Yes, and it's a very brave thing, I think, for anyone to come out that way, because you don't know what you're opening yourself up to. You might think things. I know, as my own experience as a research participant, I've had it backfire, where I would share on a date with someone that I was a part of a vaccine study for HIV. And all of a sudden have that person look at me as if I was telling them I had leprosy and it was going to come out through my breath and just infect them across the dinner table that we were talking. So it is scary no matter what. You don't know, you can't control other people's responses. But I think that's what's also brave, when people come out and are willing to share their story about their participation and have a pride in that. And I think everyone on this call can feel that. And I just wanted to sort of honor you all. I mean, Matt, Gary, and Adam, the way you've done what you've done, it really touches me. One of the things that I've done with the ACTG, the AIDS Clinical Trials Group, is I tried to get a reconfiguring of how we looked at the way that network started, because really, I think the first real start of that network was when the first patient in the very first study gave the first drops of blood. And everyone ever since then has come from that lineage of that first patient. And that happened on December 2nd of 1986. We actually found the date of that. And I think we all follow that sort of family tree of research participation, whether you are HIV negative or HIV positive, or whatever new term we come for people who might be cured going through that. We're all a part of this family tree. And so I wanted to open up this last few moments for people to be able to ask any questions while we have everyone here, of the researchers or of our other delighted and invited guests. Linda, I see you.
Absolutely. Thanks for that, Michael. And thank you, everybody, for sharing your story today, for your comments in the chat box. Please take yourself off mute and offer any comments in the last moments of our time with each other today.
Hi, yeah, it's Linda. How you doing? I just salute all the research participants, the cure participants. It's just wonderful. And I wanted to say to Mike McCune, I thought the most exciting thing I heard today was that consortium, biomarkers consortium. And I have a quick question for Chris. The PD-1 issue, you know, I mean, we're just closing down a lot of those studies for toxicity. And now it looks like we might be needing to use that again. Do you have anything to say about toxicity if you need to use the PD-1 in your CAR T-cell arena?
Yeah, there are a few things in the preliminary study that we're going to change. One is the onc boosting strategy that I talked about, and PD-1 is the other one. We think that gene editing the T cells might be a better way to do that. That's something that's been looked at a lot for CAR T cells for cancer. So we're going to try to move over to a gene editing approach, which we think will reduce the toxicity quite a bit.
Yay. Okay. Thanks so much. Great job, everybody.
Thanks for your question, Linda. Others?
This is Richard. I just want to add my thanks, particularly to Gary and Adam and Matt for sharing their stories. You know, when we go around and do conferences and forums, you know, people talk to us about how much your going public means to them. So I'm really grateful for what you do. I'm sure it's not always easy.
No, it's not always easy, but you try to be the best you can. I embrace it.
I would say that for Gary and Adam, that the narratives mean as much to the researchers as to the community at large. It's just inspiring for what we do.
And I would second that. I think in the decades that I've been working in San Francisco and with many of you, you've kept me and others that I know going just by the gallantry, the enthusiasm for learning, the interaction with the scientific field. It's just been amazing. I think, you know, you have to know in the history of medicine, there have been monumental advances made when one or a handful of people begin to have the courage to move forward into a new space. The first vaccine, right? The first dose of insulin, and these first cures really do push us forward. I would also, just if I may, like to honor the memory of Jeff Getty, who many of you know, who actually, I think, received the first bone marrow transplant. It didn't work, actually, the way it was supposed to. And Steve Deeks did it. It was my first interaction with Steve. I loved him. It was a baboon. It was a bone marrow transplant from a baboon. And Steve had to go all the way to the Institute of Medicine to get approval. Jeff was all for it, of course. This is 1994, 1995. And Jeff had a CD4 count of, I don't know what, zip. And lots of problems going on with his asthma and skin. And the baboon cells, I mean, that's crazy, right? I mean, but they did that. And lo and behold, he lived for the next 10 years. And his CD4 count went up and his skin problems got better. And we still don't exactly know what happened there. But anyway, I know many of you know him, and I know him. And I'd like to remember him and Timothy and thank all of you for all that you do.
Thanks, Mike.
I wanted to take this moment just to point out in the chat feature, if you remember, we told you there is a raffle here at the end. So we have a feedback form. And if you take the link that is here in the chat and you click on that, it'll take you to the feedback form. And if you submit the feedback form, that is your entry into the raffle. We have 5 $50 Amazon gift cards to give away, and that will be randomly selected. And you have until tomorrow at midnight. So you can fill it out today or tomorrow. We're just asking for your feedback about today's experience. And if you do that, you will be put in that raffle. There will be 5 winners from yesterday, and there'll be 5 winners from today. So that is a wonderful gift. So please take advantage of this link and give us your honest feedback and get maybe a chance of having some $50 to spend at Amazon. I think it's a beautiful little gift.
I couldn't agree more.
Yes. So it feels like we've reached a conclusion. Somehow we've guided this through to another successful ending. And so I wanted to thank you all for participating. I wanted to thank our invited speakers and our invited guests for showing up. I really appreciate everything that you've done for us and everything that you continue to do. Danielle, I'll let you have the last words for us.
I'd echo Michael's thanks here, Richard's thanks, our community's abject gratitude for each of you and your contribution to the science, and how we'll continue to work together as a global community of folks affected by HIV to get us to the end. Thank you all, and we look forward to seeing you at our next event.
All right, which, by the way, will be after CROI. So March 16th, put a bookmark if you want to hear the latest that comes out of the conference that's happening starting tomorrow. It'll be all focused on cure, and that's on the 16th. So please do join us for that. It should be a great sort of more informal way of hearing about the science that's just coming out around cure at the CROI conference that's about to happen. So thank you very much, everyone.
Awesome. Thank you. Have a great day, everybody.
Love
Thank you all.
Thanks, everybody.
Bye-bye.
Great
Thank
meeting.
you.
Bye.
Be well.
Bye-bye.
Be well. Bye, Adam.
Thank you.
Thank you. Bye, Gary, if you're still there.